In case you didn't know it, a lot of people find a lot of things that happen during labor kind of gross. So today I'm going to share 7 things that people are kind of grossed out during labor. Now, if you're the one who's like, labor is bliss, it's absolutely beautiful, I am standing next to you and I agree. And if you are one of the people that is like, this is absolutely disgusting, I can't believe every mom on earth does this, I stand with you and I totally agree. Birth can both be beautiful and very gross. So let's talk about these things because I do not want you to be caught off guard. Of course, when you're learning about things like this, you want to make sure that you're learning from an expert because this can get fear-mongery real easily. And I am not here to fear-monger you. I'm here to just give you the tips so that you know what to expect at your upcoming delivery. Hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am here to prepare you for pregnancy and your upcoming hospital birth. If that sounds like something you're interested in, come join me so that we can hang out for the rest of your pregnancy. And of course, like high-quality pregnancy content like this, so that YouTube will show you more and help my channel grow because we're really trying to grow it right now and it really means a lot when you guys like these videos. Okay, gross things at delivery. Number 1 is a lot of people poop at delivery. Now, if you're one of the few who hasn't even thought of this, which I think I was a member of that group, I am here for you because it does not matter to anyone in that room that you are pooping. In fact, as a nurse, you're going to be disgusted by this. I actually was like, sweet, we're pooping because that means that you are using the right muscles to deliver your baby. Now, I have a whole video on avoiding pooping at delivery that I will link right here, but it's really important that you understand that a lot of times you can't avoid it and you end up pooping at delivery. Really quick, in your pelvic floor and your diaphragm, these are large muscles. So you don't get to make the choice if you push through the birth canal or if you push through the poop canal. So either way, you might end up pooping at delivery. The nurse is going to take care of it. It's not a big deal, even though you think, how on earth can this not be a good deal? You know what? Because we're nurses and we're trained to do this on a variety of different people. So we got you. The second one also involves poop, and that can be baby pooping at delivery. Now, they actually can poop while they are still in the womb. Inside the amniotic sac, they can poop, and it can be a problem. If your baby poops while they're in the womb, we will call a pediatrician or a neonatologist to be there at delivery just in case baby has any issues putting that into their lungs or things like that. However, a lot of times baby just kind of poops as they are coming out. We call that terminal meconium. With my second baby, there was poop everywhere, and I was like, clean up on aisle me. Can we get some wipes over here? It wasn't my favorite, even though I'm a nurse. I don't know, my own kid pooping on me, apparently I was over that. And again, these are just things that I want you to have an idea about because there's a lot of things that catch people off guard at birth that may end up traumatizing. And I do not want that for you. That's why I'm here to help get you prepared for your upcoming birth. And in fact, if you want to get prepared for all of it, come join me in the online prenatal class for couples where we cover 3rd trimester testing, labor, birth, postpartum, so that we really prepare you for all of it so you know what to expect and you're not surprised at every corner like a roller coaster because birth doesn't need to be a roller coaster. It might not be like a field of beautiful flowers, but you can know what to expect. Okay, the next one that a lot of people think is gross is strangers in the room. Now, you may or may not know your OB. It might be a hospitalist coming on. The reality is you will only meet your labor nurse when you get to the hospital, and they may change. You might get a new nurse right before you end up having your baby. There may be, again, like we talked about, a pediatrician, a neonatologist in the room. There will be a separate nurse for the baby. And sometimes we add people like residents, nursing students, and that may really freak you out in your head right now. But you may find that when you're in labor, you really understand that all these people need specific training. And the more we can help them get that training, the better off they're going to be. Of course, if you really don't want somebody in your room at delivery, that is something you can discuss with your team. However, if it's like the neonatologist or the baby nurse, you definitely want to have them in there. So that's something to think about as well. However, residents, nursing students, sometimes we can ask them to leave. But remember, we got to train these people so that your baby has someone to deliver their babies later on. Okay, the next thing that I think catches a lot of people off guard is how bloody birth can be. Now, even when you're in early labor at home, by the way, if you want to know how to labor at home better, come join me in the online prenatal class for couples. But when you're in early labor at home, you may have some bloody discharge. We call it bloody show. And that's as your cervix is starting to dilate, it just breaks some of those blood vessels and you might bleed a little bit. Now, of course, all during pregnancy, we've been freaking out about blood. So when you have a little bit when you're in early labor, it can really be disconcerting. So talk with your provider if you have any questions. Of course, if you're soaking a pad, bad, you need to call your provider. I'm just talking about a little bit of blood. It may be dark brown, which is older blood, or it may be bright red, which is newer blood. But at delivery, there is a fair amount of blood, especially the placenta can be really a lot. So if that's something that you're not wanting to watch, you actually don't really need to. Your legs are likely going to be up in the stirrups. So if you're worried about seeing blood at delivery, it is pretty easy to not have to look at. But again, there will also be some blood postpartum. That first time we get you up to the restroom, you can be dripping some blood. I'm just saying that blood is going to be a thing. Although I've had people who freaked out about blood before they had the baby, but then after the baby, it seems to not be as much of an issue because you are an absolute warrior who just had a baby. Side note, if your partner is super squeamish around blood, let them know that blood is going to happen at delivery. They can avoid looking at it if they can, but let them know and make sure that they're eating while you're in labor so that they have some carbohydrates when they start to freak out inside. Okay, amniotic fluid really creeps a lot of people out. And you're like, how can that creep people out? It's just a natural part of pregnancy. Well, the thing is, when your water breaks, it's not a one-time gush. I know a lot of us are like, oh, we're in the grocery store, all the water comes out, and then it is dry as a bone down there. Wrong. Amniotic fluid is actually made from baby pee. As we know, babies pee all the time and they keep peeing all the time. So this is inside your uterus. There's an amniotic sac. If and when it breaks, the water comes out. But the water then collects, and every time you shift around, the water comes out into your birth canal. And so a lot of people are really grossed out by the fact that they are constantly sort of like peeing and they can't control it after their water breaks. So I think that's something to be aware of. Pro tip, I would ask your nurse to just put a stack of towels or chucks or however they take care of it in your hospital, and you and your partner can change those out as frequently as you want. I always felt bad when a patient was absolutely miserable and I had to be outside of the room for a while. You should be able to change those on your own. So just ask your nurse and they can help you out. Okay, another thing is after you have your baby, we're gonna get you up to pee. And you may notice that suddenly you don't get to control your bladder as well as you had hoped for. Now that is probably going to happen for the first 2 to 3 days, and it is going to get better. So every time I stood up to go change my pad and pee, I would leak a little bit of urine, sometimes more than just a little bit of urine. But I'm here to tell you that it should get better. And if it's not getting better by the time you go home, definitely ask your provider for a physical therapy consult so you can get that started. What a great thing physical therapy can be, especially postpartum. When your baby's born, they may be covered in this white, cheesy substance. It's sort of like we smeared cream cheese on your baby or ricotta, or the cheese of your choice. It is called Vernix, and it protects the baby while they are in the amniotic fluid from getting all shriveled like a prune while they wait to be delivered. However, it is cheesy and it is a little bit sticky. It can be there to help protect your baby's skin. Most people don't have the baby bath until about 24 hours in, so just let it be there. You can rub it in like lotion, but a lot of people kind of get grossed out by it. I know when we swaddle the baby, the Vernix can be a little bit sticky and that kind of freaks people out, but I just want you to know in advance. And side note, something I hadn't thought about but the placenta sometimes freaks people out. Now, some doctors love to give a tour of the placenta, or nurses might give you a tour. And I think it's absolutely fascinating that this thing kept your baby alive for 9 months, but a lot of people are super grossed out by it. So don't be afraid to say, nah, we would like to skip that today. And that's totally fine too. So those are the things. Are there things you're worried about getting grossed out about? Tell me in the comments. We've talked a lot about the hospital today. Let me give you my hospital bag essentials before we leave. In fact, you'll find them right here.